Hi everyone, I'm about to tell you a little bit of my story with my brain tumor. So 2018, around January, I started feeling like this intense pain on this side. It would come and go, and if I walked around it would go away. If I laid down, for some reason the pain was almost instant. So it was like that for a few months, and then I didn't really think about it. All the doctor said it was just a migraine. And then I ended up seeing an ophthalmologist for my eyelid. As you can see, this is a little bit lower than the other side. So when I close my eyes, there's a gap in there and it won't fully close. So the reason why I was going to see the ophthalmologist is so maybe he can correct it, and so to make it fully closed, because I had laser eye surgery and the cornea didn't heal right under there. So because my eyelid doesn't fully close. But since I've seen him, he noticed something was off between my eyes. He used kind of like he used a pencil, or a pen, sorry, and he did something like this, where he kind of like measured or like saw that this eye was out more than this side, and that gave him kind of like like a hint, maybe there's something behind this eye, and that kind of since he said that, it kind of explained like that could be the reason why I'm having all this pain just on the right side and not even on the other side. So since then, he sent me to get a CT. They didn't see anything from the CT, but they did see that there was something, and they weren't sure. There was an unknown something. It was inconclusive. So my family doctor sent me for an MRI, and that's where they saw it. That's where they saw that there was a tumor right behind my eye. It's called a sphenoid wing meningioma. The tumor is growing from the bone into, like, pushing my brain backwards, but it's also attached to my orbital muscle now. And it's not in my brain, but it's on the coverings of my brain, which is the dura. So there's a layer that covers the brain. And so from that MRI, I've been sent to see a doctor in Mississauga, and he refused to do any surgery on it or anything at all. He said it's just a migraine, there's nothing there, even though there was an MRI. So anyway, since then I was really discouraged, and I asked for a second opinion. I've been waiting for a call from the second doctor, but I haven't received a call for months from St. Michael's Hospital. And so the pain just got so intense where it was constantly happening, and it just wouldn't go away. So every single day, from the moment I wake up to the moment I sleep, or not even when I sleep, when I wake up, it's there. When I sleep, it's there. And it just won't go away. The pain was so intense that I was bawling. I was crying my eyes out. I couldn't stand it anymore. And so my mom had to take me to the emergency room a few times until they finally took me at St. Michael's. They almost wanted to keep me overnight. They've tried Percocets, they've tried morphine, they've tried all the narcotics you could possibly think of, and none of them worked. The only thing that worked was Toradol, and that's kind of like naproxen. So naproxen is like the step lower from that. Toradol was only given IV, and it's a short-term drug. So that was the only thing that calmed it down. And so I was prescribed naproxen for a while until I saw Dr. Spears at St. Michael's. This was a few months after, so this was around maybe July 2018. And I've been having MRIs since. So then by September, we've discussed what my options were, and because the pain was so bad, and typically meningiomas don't cause pain, or benign tumors don't cause pain. This is what they said. It was a benign tumor from what they could see. But because my tumor was symptomatic, meaning it was causing me pain and all that, and I seriously couldn't function daily. I have 2 young kids, so they decided to remove the tumor. So this was a scan, 2000, no, not that one, September 10th, 2018. So this is the right side, and this is the tumor right here. That's a tumor. And you can see that this eye was a little bit higher than this side. Here's a little closer. That's a tumor right there. So October 4th was when we decided to take out the tumor. That's when I had surgery. And from this picture, you can see that they removed the tumor. And now you can see that my eye level was pretty much aligned. But there's that space there where the tumor was. Unfortunately, the doctor said that he couldn't remove the entire tumor because it was attached to my orbital muscles, and he didn't want to nick it, meaning I could have lost movement in my right eye. So he left it there. This was my postpartum pictures. They had to cut all that. And I had staples, 33 staples to be exact. My hair grew, but I have a scar right all the way here. They had to open it, drill a small hole, and take it out. My follow-up was, after the surgery, and after all the surgery pain was gone, I had no pain whatsoever. I was so happy. I was very hopeful, very hopeful. So I went back to work. I got a new job, etc., etc. And then come May 2019, my headaches came back, and I knew that something was wrong, and I knew that the tumor had probably grown, or most likely grown. I called my doctor, I called the surgeon's office. They said it's okay, just maintain it with naproxen. So I've been taking naproxen since. There's times when naproxen doesn't work, and there's times when it does. So it's managed. I've been able to stand every single day with it, manage the pain with it. Unfortunately, I was right, and my follow-up appointment, my 1-year follow-up appointment, September 9th. That's my tumor. It grew a lot bigger and a lot longer. So now, and you could see the significant alignment on my eye right there compared to last year. Look at that's the tumor on this side. This is 2018, and this is 2019. So there's a significant growth, and sadly, with my luck, I was right that the tumor grew back and bigger this time. Second surgery is an option, but because there's more risks in surgery, the doctor decided to do radiation therapy in hopes that radiation will stop it from growing, and in hopes that from stopping it from growing, the pain will also stop growing. So I have to do 33 treatments altogether every single day, Monday to Friday, downtown Toronto, and I live in Brampton, so that's like an hour away. But yeah, that's my story. And I'm still living with this pain right there. Yeah. Bye.